go ahead.
Hi, everyone. I'm Jasmine Zarkaria,
And I'm Joseph Neuwirth.
and this is our RISE presentation, and our topic is the future of non-small cell lung cancer and the PD-1 pathway. So here's some background. Lung cancer is the most common cancer that leads to death worldwide. There's a current demand for treatments that improve response and extend survival rate, while also accounting for quality of life. NSCLC accounts for 85% of lung cancer, and immunotherapy has recently become a more popular approach to treating NSCLC, and genetic analysis can highlight the immunocomponents of the tumor. To specify, immunotherapy is treatment using one's own immune system to fight cancer.
Yeah, so kind of our process and methods. We first analyzed a lot of research, and then we kind of summarized it, put it all together. And there were three main things we noticed to this research. The first was the genetic analysis that Jasmine mentioned. This identifies what the tumor has, if it's expressing a certain pathway or getting out of the immune system's capabilities. The second is the use of drugs. Obviously, we're talking mainly about immunotherapies here. And then finally, the way to test these drugs, which is the classic clinical study, which uses survival analysis like the graph shown.
So here's some common pathways that are usually treated in non-small cell lung cancer. So first, there's programmed cell death protein 1, also known as PD-1. Then there's programmed cell death ligand 1, which is PD-L1. Then there's cytotoxic T lymphocyte-associated protein 4, which is more commonly known as CTLA4. And as you can see here, PD-1 is a common immunosuppressive in most cancers. And then PD-L1 is typically overexpressed on the surface of malignant tumors, and CTLA4 serves as a negative feedback loop for T cells. And on the right, you can see medicines that have currently passed, I think, phase 3 and have been approved by the FDA to treat NSCLC.
Yeah, so looking at conclusions and next steps, we kind of identified three main points in three directions that these immunotreatments and treatment in general has to go for this cancer. The first was the importance of genetic analysis and identifying the PD-1 pathway, because this pathway has been the most successful treatment. It's really important to know whether the tumor is expressing what Jasmine talked about, and then therefore the drugs can help. And then the second was combination therapy. So chemotherapy had immense success along with these PD-1 drugs. So they have to keep looking into that. Different combinations of therapies are always really important in cancer treatment. And then finally is using alternate immuno treatments like vaccines, other ways to activate the immune system. So yeah, thank you.